Good afternoon, and welcome to, we are meeting the February 20th Senate Human Services Committee. It is Wednesday, and we're doing a Minnesota day outside. Be prepared. I hope everybody has their shovels. And before we start, I was sitting here, and somebody left one of my coffee mugs that had my name on it in the back room on a table, and I'm kind of feeling codependent right now on saying, why would anybody want to do that? But that's sorry, I'm trying to be funny, and we know what my wife says. But Senator Elise Mann, we're here to specifically, and I want to talk on the paid family leave, medical paid family leave, the full length of the conversation. What I wanted to make sure that we are doing in this committee is specifically having a conversation about how this affects when you look at rates, right? And I don't want to get into a rate wage discussion or a percentage of what if this. I think there are people that we know at the Department of Human Services that understand that fiscal conversation on a percentage of X versus a percentage of Y. So what I did is, and we'll talk about this when we get to that, is I want to make sure that our conversation today specifically focuses on those topics that are in the jurisdiction of human services. And so anybody that's following along, if you just look at 256B and decide to draw an umbrella over that and start to focus down any of those providers or individuals that specifically get their wages based on the rates they get that come from the state of Minnesota, that is where the filter for me and for this committee is. Does that make sense, Dr. Mann or Senator Mann? And so as we're conversating today, I think if we can stay focused on that, and even as we bring up, like there's an MAEPD discussion in there that's absolutely jurisdictional to hear, even though somebody sees another word in there, they're going, oh, what's this about? You know, then I want to bring Sean Burke up, who's a lawyer who used to work at the Disability Law Center now, to explain how that fits in, and then we can go from there. So does that make sense to everybody here on the committee, what we're trying to accomplish today? Any questions? So who left my mug on the back table?
I'm sorry.
Was that Omar? I'm kidding. Does that make sense to you guys down here? We're good? All right. Senator Elise Mann, welcome to the committee.
Thank you, Mr. Chair.
Talk about your bill.
Thank you, members. So Senate File 2 will establish Minnesota's paid family and medical leave program. The United States is one of 7 countries out of almost 200 that does not have a paid leave program, and the remaining 6 are largely micro islands. In response, 11 states and DC have started their own programs, and the data is undeniable when it comes to the benefits of such a program. We see better health outcomes for moms and babies, decreased rates of ear infections, GI infections, pneumonia, decreased clinic visits, decreased hospitalization rates. We see better maternal mental health outcomes. We see increased rates and duration of breastfeeding. We also see increased employee retention and attachment to the workforce. It is a gender justice issue, a racial justice issue. It is a workforce shortage issue, a child care issue, and a long-term care issue. But what we often do not talk about, and what is pertinent to today's hearing specifically, is that paid family and medical leave is also a disability rights issue. It is a vital support for workers with disabilities as well as for family members who care for people who have disabilities. There are more than 6 million people with a disability in the U.S. labor force, and these individuals may need access to paid leave to take time away from work to care for their own health, or to provide care for a family member. We often think of people living with disabilities as them not caring for other people, but this is false. Additionally, the 61 million Americans living with disabilities may need their family members to take paid leave to provide them with care related to their health condition. Workers with disabilities are less likely to have access to paid leave because they are disproportionately employed in part-time and low-wage work, where less than 10% of the workforce has access to paid leave. So this makes perfect sense because historically, safety net programs have disproportionately left out women, people of color, and people living with disabilities. We crafted a bill that leaves out no one. Our policy includes key components that makes inclusion of people living with disabilities, such as comprehensive purposes for leave, including medical and caregiving leave, expanded family definition to allow caregiving for extended and chosen family, and progressive wage replacement to ensure that low-wage workers can afford to take leave. The benefit is also portable, which is important for part-time employees. So I appreciate the conversation today to highlight those things and the opportunity to make this bill even better.
Senator Mann, thank you. I want to know, members, you have, I think there are 9, if I counted this right. I was not a math major, I was a sociology major, but I think there's 9 handouts in your packet, just from various folks. And then there is, on our list, there is 9, actually 10 we added. There's 10 folks that want to talk about it. Do we want to listen to people first and then start talking about some amendments? I know Senator Rasmussen, Senator Mann, I have a couple to discuss at the table as well. So should we hear from people first? Does that sound like what we want to do? Senator Mann, does that make sense? All right. So, and I would hope, here's the thing, when you're coming down and you're having a conversation, please keep it to the jurisdiction of Human Services and help us, because I want to have a deep discussion. So if you could help us by keeping, I believe Kevin had already said 2 minutes, right? Do I need to put a timer on this one? He actually said 3 minutes. I'm sorry, I sit here corrected, so that's okay. But if you could just really get to the topic at hand, I would appreciate that, I think, for our conversation going forward. So Julie Johnson from MSS and Mohar, I know you're coming up. Nice to see you again, by the way, Julie. And then Toby and Aaron, you're in the batter's deck, so when Julie's done, then maybe Toby Pearson and Aaron Hupper can come up. And perhaps, if Phil Griffin, if you're here, Phil Griffin, if you're here, right? Come on up, Phil, next to Julie. You might as well get Mohar and then Arm, and then Toby and Aaron. You guys can go after that. Does that make sense to everybody? All right. And Ken Bentz is also with Arm, so geez, we're going to have to get 4 desks, 4 chairs. That's okay. You're good. Julie, welcome, Julie Johnson. Nice to see you again. Welcome to the committee.
Thank you, Mr. Chair and committee members. My name is Julie Johnson. I'm the president of an organization called MSS, who provide day and employment services and supports to adults with disabilities. I'm also the president of MORE. Senator Hoffman renamed that, the chair a little bit, but MORE is an organization that supports 100 nonprofit organizations across the state who do the same thing, supporting adults with disabilities and day and employment, high-quality supports to engage in the community. Thank you for the opportunity to briefly talk today about the paid family medical leave benefit proposal. For our disability service provider members, our staff are truly the cornerstone who work successfully to support people with disabilities. The services that our staff provide and the roles that they play help ensure people with disabilities live engaged and connected community lives. Given how incredibly hardworking our staff are, more members do all they can to continuously bolster staff pay and benefits. We support the intent of Senate File 2 to add an additional benefit of paid family leave. However, these efforts to implement increased statewide employee benefits must be coupled with the necessary legislative adjustments to service reimbursement rates. Our organizational members operate primarily on these state-set reimbursement rates. We are unable to adjust our services costs in an effort to cover the cost of these new important benefits. And due to the current extreme workforce shortage in the disability services area, many of our member organizations have already invested in staff wages and benefits at levels that are not covered by our current state-set medical reimbursement rates. And we are already running deficit budgets, my organization included. We at Moore are asking the legislature to make necessary adjustments to our rate reimbursement system, the disability waiver rate system, so that we have the funding available to offer this new benefit that you are advancing. We greatly appreciate the constructive conversation we were recently able to have with the Senate author of this bill, and we look forward to continuing these conversations to find creative solutions. Lastly, I would be remiss if I did not take the opportunity to highlight the critical need for the legislature to invest in base wages for our incredibly valuable staff. While it's important to address the benefits that we are able to offer, the current wages afforded by the state-set reimbursement rates are simply not livable wages. I encourage the legislature to enact the Best Life Alliance bill, Senate File 1015, to help move our state towards paying these staff wages so we can continue to provide the necessary services and supports. Thank you very much for your time, and I'm happy to take any questions that you have.
Any questions for Ms. Johnson? So just so we're very clear, right, the only way that you're able to give any kind of raises or any kind of reimbursement to your staff is if the state of Minnesota sets their rate methodology under their DWRS specifically to that point. Is that correct?
That is correct.
So it's state money that drives you. All right, that's all I needed to know. Any members, questions? No? Thank you, Ms. Johnson.
Thank you.
Phil Griffin and Ken Bentz from ARM, thank you for coming on up. Mr. Griffin, go ahead.
Thank you, Mr. Chairman, members. Thank you for the opportunity to testify today. My name is Phil Griffin. I work for Ewald Consulting, and I'm here today speaking to you on behalf of the Best Life Alliance. As you know, the Best Life Alliance is a coalition made up of over 130 waivered service organizations for people with disabilities, their residents and clients, and families of those receiving those services. As a coalition, we want to applaud your efforts to establish a paid family leave program in Minnesota. However, we do want to express our very sincere concerns about the significant financial challenges the implementation of a family leave program will bring to disability service providers and their clients. These providers are already paid at extremely low reimbursement rates. Homes and programs are closing, and the system is under unsustainable stress. We need your assistance in dealing with that and what will eventually pass in this legislation. The majority of our workforce is overwhelmingly women, and we do attempt to offer competitive wages and benefits, but with over 95% of our reimbursement coming from the Medicaid program, it is up to you to fund these costs of this program through the Disability Waiver Rate System, DWRS. I understand that we often classify groups at the legislature as either for or against legislation as concepts and bills are debated. However, the case in this bill is much more nuanced than in this situation. This is an extraordinarily complicated situation. You cannot classify positions as either favoring or opposing. We support your intent, but we need the funding for DWRS to survive the implementation. We've begun working with Senator Mann to address these concerns that I'm raising today, and look forward to continuing to work with her and with others as we move this bill through the process. Mr. Chairman, I'd like to turn to my colleague Ken Bentz, Director of Research, Policy, and Analysis for ARM, to provide you with details on how providers are reimbursed and the necessary changes needed to DWRS to enable the system to sustain and obtain federal matching funds.
Mr. Bentz.
Thank you, Senator Hoffman and committee members. For the record, my name is Ken Bentz. I'm the Director of Research, Analysis, and Policy for ARM, an association of 130 provider organizations who provide home and community-based waiver services for people primarily in residential settings. As Ms. Johnson and Mr. Griffin both stated, we support the intent of this bill. The issue is, where did the funds come from? As was stated, the reimbursement for waiver services comes solely through statutory language, and therefore it takes act of the legislature to make increases or to make changes. Minnesota is one of the only states in the nation which has reimbursement rates so explicitly driven through the legislative process, and due to that, we appear before you on a regular basis to talk about these kinds of issues. And so we ask for your support in finding a mechanism either through the disability waiver rate system or through some other means to provide our provider organizations with the additional revenue that they would need to be able to provide these benefits to the level in which they are desired. Thanks.
Mr. Bentz, thank you. Any questions for Senator Abler?
Thank you, Mr. Chair. I'm sorry I was late. We were discussing drugs.
Do you have your note from your mom?
You know, I was tardy to the Education Committee. They said I get 2.
Really?
Yeah, I don't know how many I get here, Mr. Chair. So, I'll get my mom to write me a note.
Thank you. Senator
Anyway,
Wood.
so, I mean, I shouldn't laugh. This is a pretty serious bill, and and the intent is well intended, and I get that. So, is it okay to ask questions now?
Yeah, that's, I mean, I think
All right.
this is as we're going on.
Yeah.
Because one of the things that I want to make sure, as we're looking at, there's lots of people involved in this, and so far from the testifiers, Senator Abler, their ability to have any kinds of money available to the people they serve is through the legislature, the legislative process, right?
Right.
And 195% or whatever, but the fact is the only way that they're able to offer is the fact the state of Minnesota says, here's your disability rate system, DWRS. It just thinks 10 years ago, you and I were working on that. So I just want to be very clear on that piece of it, that there's lots of people affected by this. It's a great, and I'm hearing from folks that this is a wonderful thing to do. And then there's a but clause, right? And this is where you're at. So Senator Abler, absolutely ask away.
Well, thanks. And I know you're working on something. I don't even know how far those discussions have gone, and that'll come up later when you tell us. But
Sure.
But so in the meantime, so in the bill, Senator Mann, it's like 0.7 to 1.2%, I think, is the current state of the bill. And so I don't have that many questions. I could ask 6, but I'll just ask a couple. And so whatever the rate is, could either of you comment about how you would plan to pay for that? Assuming, I mean, do you think you'd try to require employees to pay their half, and you would try to find a way to afford your half, or have you thought about that?
Mr. Benz?
Thank you, Senator Hoffman, Senator Abler. We've given this some thought, and I don't want to speak for Senator Mann, but there is a provision in the disability waiver rate system, so you do the same thing that you do, you stumble over those words, on employee-related expenses. So a commensurate percentage could be added into that component value in the DWRS. That was one idea that we had come up with. That would be one mechanism. There may be others as well.
Senator Abler?
Mr. Chair, but let's say no law changes and you have the present law. And so would it be your intent to go halvesies like is anticipated by the bill? And you would somehow try to find a way to come up with your money, and where that comes from you can debate, and then have the employers come up, employees share. Would that be what you're thinking? If that's not your preference, but what would you think, how you try to handle it?
Mr. Benz?
Sorry. My understanding is the bill as it's written gives the employer the option of allowing employees to provide up to half of the amount. That would be an employer by employer decision based on their own business needs.
Senator Abler?
Well, thanks. And the idea that an employee who makes as little as they make to be asked to pay their share would be hard. And I think once one employer decided to pay, you'd all have to pay. So it's really a matter of 0.7 to 1.2. And we've been, you've sat through this committee a little bit, and it's just the pressure on rates is significant. So I understand that part. The other part of my question is on the replacement staff. So a person goes out for whatever length of time, for whatever purposes. Ostensibly, the money to pay them is still sitting in your budget. But then if there aren't people to work, I'm sure you've thought about that. And then if you did have to use an agency or something, do you have an idea about the math? What it would take to replace those individuals, like what percentage of the payroll of that individual? Is it 50% more or something? And do you think you even could find ways to staff?
So Senator Abler, that same issue that you're bringing to the ARM also fits in the Ms. Johnson, who's up here. They end up going to outside staff, which charge more. Have you given much thought to that? Mr. Benz?
Thank you, Senator Hoffman, Senator Abler. Again, I think that would be an employer-specific decision. How they're functioning now is when people go on PTO or have to take time off, they have to backfill with existing staff if they can, or go to an agency as you suggested. Agencies come at a very high premium. If they can use existing staff, either work overtime or additional hours, it probably wouldn't be as high of a premium over the straight time that they would be paying otherwise. But I think it's fair to say that there would be a premium to backfilling positions when they're on paid leave.
Well, thanks.
Senator Abler?
Mr. Chair, I'll stop pretty quick, but and Senator Mann, I'm not going to, I know this seems like a great thing to you, and I appreciate that. I'm happy to be able to talk about this with these folks, because you're already short, what, 51,000 people or something, and so it's hard to think that you could draw from that pool of negative 51,000 to fill in the gap. So you can comment about that, or I'm done, Mr. Chair.
Thank you, Senator Abler. Mr. Bentz or Mr. Griffin?
Mr. Chairman, if I might, I know we shouldn't make legislation based on anecdote, but my wife and I had dinner with very good friends of ours last night. Their daughter suffered, as a result of surgery, of real traumatic injury that has resulted in her disability. She's now living in one of ARM's members' homes. And the kind of squeeze that you get when you don't have staff is what our friends were experiencing. They're now bringing their daughter home on weekends because she can't stay there because they don't have enough staff to take care of those people. And the person who's the supervisor in that home is expecting a baby that will be induced on Friday of this week. And they don't know where they're going to find somebody to replace her when that happens. Does this mean that our friend's daughter has to come home? They're not sure. But at age 70, they're no longer capable of lifting and doing the kinds of things that we do. So the unintended consequences of things that we do at the legislature are sometimes the things we have to watch out for. And we're appreciative of the fact that Senator Mann has been discussing this with us and trying to look for ways to solve how we pay for this. But as the chair points out, these are very difficult problems.
Mr. Senator Abler, you're good. I mean, that's the whole issue. It's that circle. We have 53,000 caregivers that are vacant, and again, it comes down to the rate methodology conversation. And, I know in the other body, right, the other body, right, Senator Omar, the other body, Representative Noor, has talked to us specifically about how do you get folks to $20 an hour. It's kind of a, he keeps that theme going, and it's like, okay, and there's an X factor. Well, the X factor still sits me. I don't know if you're aware of $1.825 billion that's sitting in the surplus that should have been spent in Health and Human Services. And I'm sitting here, it's a true statement, but these are real issues that you bring up that are systemic stuff that we look at. I appreciate you two coming here, and with that, I thank you for your testimony.
Thank you,
Mr. Chair.
Yeah, Senator Mann.
I just wanted to highlight that this is not a unique issue to what we're talking about right now. We're having a workforce shortage problem across all sectors. This bill does not create a need for leave. It simply changes the way we treat people when they do take leave. So I just wanted to point that out.
No, I thank you, Senator Mann, for that. That's exactly what it's doing. I get that, and I do it, and it's the need for the discussion about, so in this sector that's jurisdictional to this committee, what does that look like? How can we make it work? What do we need to do to ensure that organizations aren't sitting there going, how am I going to come up with the money? And again, comes down to, we just heard from two agencies that, you're talking 200 different organizations that, the only way they get their money is through the rate methodology. So, no, thank you for bringing that up. Senator Abler.
And thanks for the dialogue. The Senator Mann's comment just made me desire another question of the two people here. Creating the need, and I get it. People get sick, their family gets sick, or something bad happens. In the opinion of the two of you, will this increase the amount of people who will be seeking time off that you'll have to fill a gap about?
Mr. Bentz? Mr. Griffin?
Thank you, Chair Hoffman. Senator Abler, that's a good question. I wonder if Ms. Johnson would have an answer as an employer from her experience to talk about this.
Yeah. Oh, she can come back later. Whatever, Mr.
She
Chair.
can come back later. That's fine. We can, Julie, stick around if you would. That would be nice. So nothing else. We're good.
Thank you, Mr. Chairman.
Thank you, gentlemen. Thank you. And thank you for the work that you represent, the different agencies out there. I appreciate hearing from you. Toby Pearson, Care Providers of Minnesota, on behalf of the Long-Term Care Imperative, and Aaron Huppert from Leading Age Minnesota, also on behalf of the Long-Term Care Imperative. Welcome, you two, to the committee.
Great. Thank you very much, Mr. Chair. Mr. Chair, members of the committee, my name is Erin Hubert with Leading Age Minnesota, one half of the Long-Term Care Imperative. My colleague will introduce himself for the record in just a moment. Together, our two organizations represent over 2,000 providers across the long-term care continuum. That includes adult day services, assisted living, and skilled nursing home care. We thank you for the opportunity to testify on Senate File 2, paid family leave. We appreciate the legislature's efforts. We appreciate Senator Mann's efforts to institute a paid family leave program in Minnesota. We agree that supporting workers and their ability to raise and care for their family is an important value to have in Minnesota, especially in the wake of the pandemic, especially in the wake of our workforce shortages. And in support of that shared goal, we have 3 considerations to raise with you as you deliberate this legislation. So I will cover one of those and then turn things over to my colleague to address the other 2. I think picking up perhaps where some of our human services provider colleagues have left things off on the previous testimony, we do recognize the value that this bill offers for workers and their families. We also have to acknowledge that providing care for Minnesota seniors is a 24/7 commitment, and therefore we have to balance the goals of this proposal with the operational and regulatory requirements that come with serving vulnerable adults. Importantly, we are required by state and federal regulations to have sufficient staff to care for those seniors who are entrusting us for their daily care and services. In August of 2022, the Long-Term Care Imperative found that of nursing homes who were at risk of closure or sale, over 90% reported leadership staff were regularly working direct care, housekeeping, or dietary shifts at least once per week. And as you know, we remain in a pretty critical workforce shortage. Our most recent survey of providers, which was just completed last month, indicates that we still have about 20,000 vacancies within our sector, or about 20% of the workforce. And as a result of those vacancies, seniors were turned away from communities 11,000 times in just 1 month. And I provide that background because our concern is, in part, that the definitions and length of leave provided for in this bill, at a time when we are already struggling to have enough staff to care for residents, will have an impact on the strain of additional staff, and we are really concerned about what that does for access to care across our long-term care settings. So put it as simply as we can, we do not know where additional staff will come from to accommodate leave provided for in this bill for some of our settings. We already rely on supplemental agency staff with their exorbitant rates and know that that is not a long-term solution. And so we look forward to working with you and the Senate author on how to resolve that particular challenge. And then I will turn things over to my colleague.
Thank you. Any questions? Mr. Toby Pearson. Senator Abler, I'm sorry. I'm going to go. Just, you can stay. Toby.
Mr. Chair, members, my name is Toby Pearson with Care Providers in Minnesota. I'm here today on behalf of the Long-Term Care Imperative. As my colleague mentioned, it is no surprise there are struggles in long-term care. We agree that supporting workers and their ability to raise and care for their families is an important value, especially in the wake of the pandemic and the workforce shortages that resulted. As mentioned, we have supported Chair Hoffman and Senate efforts to give increases to workers. However, long-term care services rely on the state for reimbursement. It's unclear how this Senate file will reflect the cost of premiums within our payment mechanisms like Medicaid waivers and value-based reimbursement. In 2019, DHS did a study that found that payment rates provided for services like customized living, assisted living, or home care under elderly waiver are not sufficient to cover the costs of care. We join our other provider colleagues in respectfully asking that premiums and other employer costs associated with providing this benefit are explicitly reflected in our state's Medicaid program. Within aging services, a critical element of long-term care is our caregivers. The average starting wage for a caregiver in assisted living is about $16 an hour. The average starting wage for a caregiver in a nursing home is about $17 an hour. We know from our own employees and from competition within the labor market that take-home pay is one of, if not the top concern for our workers. While this proposal offers paid time off for employees in Minnesota for our sector, it would also do a great deed to provide higher wages, which is controlled by the legislature. Therefore, we encourage you to also support the critical need to raise caregiver wages, those who are funded through the state investments by passing either Senate File 780, which is our preferred, or Senate File 7, your bill, Mr. Chair. This would ensure that our long-term caregivers are compensated with wages that are higher, affirming that whether they are serving seniors in our settings or caring for their loved ones at home, they are able to earn a livable wage that truly supports raising a family in Minnesota. Thank you for hearing our concerns.
Thank you, Mr. Pearson. Senator Abler.
And I don't want to hog all the questions, but we asked a question before about, like, I feel like this is just, we discussed this over and over again, but now there's another situation where we're going to be offloading some staff for very worthy purposes. And so you mentioned Ms. Hoopert and Mr. Toby, you didn't really help you mention it, but do you have any idea to what extent, I think, is it thought that 7% will use this, Senator Mann? Is that the number that you're using about who will use this? Somebody, I heard that number somewhere. Is that the number you're going with?
Senator Mann?
No, it was less than that. I think it was like 2 to 3% of the workforce. Is that correct? I think that was it.
In a year?
Yeah, in a year.
Okay. All right. Anyway, so, and that's subject, I would imagine that the lower paid workforce might use it more, it seems to me, just because they were finally getting a chance to. You don't think so? That's not shown? All right. Well, I don't know.
Senator Mann, yeah.
I just made that up, so I don't know. So go ahead.
No, generally, thank you, Mr. Chair, the lower wage workers use it less because it's more difficult for them to stay at home at partial wage replacement. So we tried to address that in the bill by having a progressive wage replacement, but generally that is not the case.
Oh, well, that's,
So,
Helps
Senator
these guys.
Abler, Senator Mann, so that wage replacement, how would that, does that fit back into, you know, when I'm a 245D provider, let's say, right?
Yeah.
And I need to get, because I have ratios, the Department of Human Services, ratios, right? I have to have 1 to 4, 1 to 3, 1 to 6, depending upon my IDT team's verification of what I need, right? And I can't make it, and I have to go to these, you know, temp agencies where they charge a premium, and that premium is almost twice what the reimbursement rate is. So I'm now, you know, I'm fiscally tight anyway. So does that offset that, Senator Mann? Help me understand that, what you just,
What
that
was the
piece you
question?
just, the comment you just made,
Yeah.
does that offset the replacement side of it? Does that, how much is in there, or what's the percentage? Does that offset some of those providers, or is that specific to the person?
That is specific to the person, Mr. Chair.
Okay. Interesting.
yeah. Can I go back to my?
Yeah, no, I mean, that's what I wanted this to be, Jim, was
Yeah.
a conversation regarding, you know, what does that look like for the folks that are in
Yeah.
this jurisdiction?
So what's the upcharge to replace your employees? And do you think you can replace the ones who are missing?
Aaron
because of
or
this?
Toby?
So, Mr. Chair, Senator Abler, we have started to look at what kind of the replacement cost. I think that's kind of the figure that you're talking about, and that would mean, for example, if you had to pay an employee overtime to fill a position that a employee was gone on family leave because they then went into overtime hours, or as was mentioned, if you had to hire people from a staffing agency, there's a percentage of that charge that gets put into other operating, or it's just a higher cost for the employer, whether it be assisted living or the nursing facility. And we kind of assumed that it would be somewhere around a $25 an hour higher cost for the folks when you're replacing that employee for the various upcharges that you can be subject to because you're trying to fill those positions. And the total cost, if we did that, I mean, in elderly waiver, our first run at it, as we started to look at this, and we haven't fully dissected all of the language, in elderly waiver, you're looking at probably $8 million-ish total. Skilled nursing facilities, you're probably closer to $14-15 million cost. The other thing that needed to be clarified, and I think maybe DHS can clarify it for us, is on the value-based reimbursement for skilled nursing facilities. If the facility chooses to pay both percentages instead of splitting it, would that full percentage then be attributed to care-related, which would be in essence a pass-through, or would it be subject to a half, or how would it, or would it be treated as other operating? There's some detailed things within that that we're hoping to get some more clarity on from DHS as this moves forward. As we have said, and we've mentioned to the author, it's not that we oppose paying family leave for our workers. That's not what we're saying. What we're saying is similar to what the disabilities said, which is there are state costs to us being able to do that.
Yep.
And that's all we're trying to clarify.
I'll leave it at that. I could ask many more questions, but
No, I
we have more people to talk. So.
No, we do, but I think this is exactly where the conversation needed to go, Senator Abler. I know Senator Utke has a follow-up, but, you know, the clarity, I've not heard from one person to tell me this is, right? I mean, I've not heard that. I don't know if you can have an adjective to, but rather, I'm hearing specifically that, you know, people want this. You know, there's a but clause, and I'm glad we were able to look at, you know, the umbrella that we're looking at in having this discussion. It's like, because I think the follow-up is, and maybe as this goes through, where is our DHS team? You know, what kind of follow-up do we need from them to get some technical assistance, right, on this to do that? And then that, you know, the disposition of the bill from this committee, you know, really depends upon how we look at that conversation going forward, Toby. So does it make sense? So Senator Utke, go ahead.
Thank you, Mr. Chair. And I've got a lot of comments. I'll save most of them until after we're done with the testifiers. But just the conversation we're having here right now, if the places they represent could get these extra employees, we're talking about where they're going to get them from, because there isn't one of the long-term care facilities that's running at capacity now, and it's not because there's not people wanting to get in, it's because they don't have employees. So I think this only magnifies the problem. They can't go out and manufacture employees, so you're going to be working with traveling staff, which I saw your number of $25 an hour maybe increase. I think you're going to be a lot higher than that. It's going to create a huge problem. And it goes back to the fact, in any business, your employees are your most valuable people. They're already going to do everything possible to accommodate them. It's just, you got to work within the parameters of what the business is. And in this case, we're talking about, you know, things related to this committee, long-term care, and the disability communities. You know, this is nothing but, I'll say it, a disaster, because they're all based on government reimbursements.
Yep.
And they can't currently pay enough to retain and recruit. This only makes it worse, so that's what I'm afraid of.
No, it gets to your point, Senator Ike, that we always talk about, you know, on the DWRS system, the rate methodology comes back to the first premise of this argument, not argument, but discussion is, you know, the rates, reimbursement rates, right? In order to make something happen, what are we doing as a system? And we know the system is absolutely, we got 53,000 caregivers opening that. I mean, that's been the same since last year when you and Senator Abler had your two different chairs, where you were chairs of the two different committees that were there, and now it's Senator Wickland.
That's exactly right. I mean, 51,000 plus short.
Yep.
We have nobody, there's no pool to go get people from. And that's the thing we have to keep in mind. They're struggling to the max already.
Yeah, that's the bigger picture.
We just got to make sure we don't make it worse.
No, I hear you. That's absolutely. Senator Fate.
Yeah, thank you, Mr. Chair. And first, thank you all for coming out and testifying today. Before anything, I'm of the opinion that we need to do something to help our providers cover this. But at the same time, I want to make it clear that this isn't about whether or not employees take time off. This is about how we handle how they take time off, whether or not they're covered. And this idea that there's going to be this explosion of a large number of folks suddenly taking time off is false. There was a research paper done by the Department of Health that showed that people with paid time off actually take less time than people that don't have it. So I think we need to take that into consideration as well. Thank you.
No. To that point, I mean, that's what, Senator Mann had talked about. I think the number was 2% or something like that. Was that 7% or something? I can't. But, it's like, okay. But really it gets to that other, the bigger, the essence of this conversation is, there's $1.825 billion. I don't know if you heard, but, I just want that money back in the Department of Human Services bucket plus what we need going forward. Senator Abler.
Well, thank you. And to that point, Mr. Chair, that money is for other purposes. That means certainly a budget.
Yeah.
But this is a new feature. This should just come out of a whole new pot of money.
Yes.
But so, Senator Mann, just the question about who's going to use it is actually, I think, an open-ended question. And it's a function, you're the author of the bill, it's a function of the definitions about when is a person sick and when are they going to help their family person and who is a family person. And so the broader the definitions, the larger the impact. The more tight the definitions, the better. And we have not talked about this lately, but there's been discussion about going to the more national family leave definitions, which people understand, which help multi-state companies to handle this better, et cetera. And that's not the topic. Well, it's a sideways topic for this area. And so the broader the definition and the more undefined the people groups that could be affected by this, the more people are going to actually be affecting this industry as well. So that's all part of the mix. And so the more defined the terms, the less the impact. So thank you. You can comment to that if you want.
Mr. Chair.
Senator Mann.
Yeah, so we've had this conversation many times with many different people, and I understand what you're saying, and in many cases that is absolutely true. However, in this particular case, again, safety nets have historically left out people of color and women and people with disabilities. That's what they do, right? FMLA, for example. So we are writing a bill that does the opposite of that. We are going to include all those people because those people don't have access to other leave. We have built this machine where we make people work, but we don't allow them to live their lives at the same time. So low-wage workers, again, women, people of color, people living with disabilities have no access to leave. Many don't have a day off. And so they quit. They don't come back to work. Mm-hmm. And that's why we're having a large part of this workforce shortage issue is because we've created this system where people cannot live their lives and work at the same time. So this allows people to do both. And we have seen that when they do that, they come back to the workforce at significantly higher rates than when they don't have access to this. And the definition is broad, again, because I'm looking at this bill through an equity lens. Because you said something to me that rang a bell earlier today. You said, I feel like I'm the only person that cares about these people. And we are constantly writing bills to appease white Minnesotans and use white Minnesotan definitions of family and what it means. These definitions are through an equity lens that look at what family means to communities of color and to people with disabilities and to people living in rural Minnesota. So it is a broad definition. It is on purpose because I will not exclude those people.
Nice. Senator Matthews.
Thank you, Mr. Chair. I'd like to ask Ms. Hoopert to clarify something that you shared. It's coming down to you're talking about needing more manpower and a pool of workers that you don't have access to, don't know where it would come from. And the bill and maybe some of the amendments that we're adding here is coming up with a solution of money. And So I'd like you to clarify if I heard correctly or expound on this. If you have money and you're still struggling with the issue of manpower currently, do you feel more funding or more money is a partial solution, a full solution, no solution at all? How, if it's just a partial solution, how that will help and what's still gonna struggle with? That's what I'd like you to help clarify based on your earlier comments. Thank you.
Ms. Hubert.
Thank you, Mr. Chair, Senator Matthews. I think if I understand the question, there are remedies or solutions that we might want to pursue specific to Senate File 2, and that includes ensuring that our Medicaid systems, our nursing home reimbursement systems pay for the leaves that are provided in this bill. I think more broadly around workforce shortage and rebuilding that pipeline, it will probably take a couple of years, but I think what we keep hearing from staff and from people who work in long-term care, until we address the structural challenge with our wages and bring those wages up, we will continue to chase workers and continue to chase the other job sectors that can compete much more in a tight labor market. And so ultimately, I think our position would be that if Senate File 2 moves forward, it has to do so in conjunction with other legislation that addresses that underlying wage problem.
Yep, Senator Matthews, to that point, absolutely. That's the whole thing we've been, for the last few years, we've been just talking about how do we get that rate reimbursement up. I mean, I just remember 2 years ago, the picture of Burnsville, the McDonald's in Burnsville. Not that I care about Burnsville. No, don't say I don't care about, but I do, right? Here was this big picture. It said starting wage at McDonald's, $21 an hour, and yet at the same time, Julie Johnsons of the world are, paying people $15 an hour. And it was like, to get to that, we thought we had victory a couple years ago. So Senator Fate, unless Matthews, did you have a follow-up to that?
Yeah, no, thank you, Mr. Chair. Very good point. And I go back to the story I shared a week or two ago in a different aspect, but this is where all the concern centers around, where a family really needs help in a crisis situation and there's none to be had.
Right, I remember that.
And that's the fear in this whole universe here of what the discussion is today. And if we get to that point, then, all these lofty goals and ideals are moot if there's nothing to be had there overall. And then, pointing to the reports and the studies and all of that, Mr. Chair, I'm still skeptical. I want to see it. I want to see the evidence of that because we're really good at over-promising in a lot of areas around here, and then we go implement it on the ground, and we come back a few years later and go, boy, that didn't turn out the way we expected it would. And so I still want to urge everyone here, even those supporting the bill, to be very cautious of that, be very mindful of that, because I have a hunch it's not going to be at the levels or predictions that you're saying it will, and we need to keep providers like this in mind so that we don't lose services altogether for people that need it.
No, here, Senator Fate, then Senator Ayler, then Senator Mitchell.
Thank you, Senator, Mr. Chair. And I'm asking this also again in the belief that the state should do more on their part. But this is for any of the three testifiers. Is there any information or an average or maybe ballpark how much providers pay to train, recruit, and onboard new employees? Because if data is showing that with paid family leave, there's an increase in workforce participation, but also a reduction in turnover, there could be either savings or at least an offset in costs. So is there any information around that?
Yep, Aaron or Toby?
Mr. Chair, Senator, I don't know the exact place that they got it, but when our data folks were putting together our replacement costs, that is part of what they tried to factor in to look at why it ended up being a number lower than a lot of people expected as 25, because we were anticipating less turnover. So you would have less of that replacement cost because you would have more consistent employees, but there still is, overall, there's marginally a cost for that replacement worker.
Senator Fate? Thank you, that's good. Senator Mitchell? No, I'm sorry, Senator Abler, then Senator Mitchell. Senator Mitchell, did you? Yeah.
Thank you, Mr. Chair. I just have to say, as someone who ended up using emergency medical leave once, and someone who's not motivated by money, a lot of the work I've done in my career has been things that have been meaningful to me. I would probably do a comparison of a place that would provide for me an emergency versus wouldn't in just taking the job in the first place. So, you know, when we look at everything that a company is able to offer, to me, especially this solution, which is set up like unemployment insurance, where kind of everyone can have that equal footing, would be very meaningful in terms of allowing me to look at a job more seriously. But to Senator Matthews' point, my question is to Senator Mann, when he thinks there could be unintended consequences, haven't we studied this in a number of states to see what the outcome is able to be once this is implemented?
Senator Mann?
Thank you, Mr. Chair. We have, right? We've been studying this for over 10 years in different states, and the outcomes vary widely. But at the end of the day, there's hardly a downside, right? Increased employee retention, it helps the workforce shortage issue, it helps their child care crisis issue, it helps long-term care, all these things. Leave is already happening, right? This leave, this bill, these programs in other states do not create the need for leave. And people do not just go on a 12-week vacation at partial wage replacement. We don't see that happen. People take less than what they are entitled to and get back to work when they can. And there is zero reason to believe that Minnesotans are less hardworking than the rest of the country. In fact, I would argue the exact opposite. And we've seen not only in the businesses, but in the workforce, but the healthcare outcomes are enormous. I mean, everything from infections to premature birth have been impacted by this policy. And so, yeah, I often bring the box of studies with me. There is a box of studies to talk about all these different things, how all these different things are impacted. And again, this bill doesn't pass and all of a sudden everybody goes on vacation. That does not happen. That does not occur. We have a workforce shortage crisis right now, and this bill helps with that in the short term, but also in the long term.
Senator Mitchell's a follow-up, not Senator Abler, and then we need to I want to eventually get to the robust discussion on that, but I'm glad Senator Mitchell brought up this operates like unemployment insurance. And there's an MAEPD provision that we have coming up that kind of looks at that as well, especially when it comes to treating people with equity. So, Senator Abler.
Well, thanks, and I can continue this offline. And Senator Mann, I appreciated your response to my question, and it helps me understand. We don't question people's intent, but it helps me understand what you're thinking as you're putting this together. My concern is that what I'm talking about has nothing to do with harming people with equity differentials or people of the whole list in your people in your mind. But it has to do with defining who is a person that you're kind of to help, if you're to help. And I'll just give you a single example, a sibling's spouse. And if indeed you're kind of designed, if it's in your role that you're kind of helping caretake the sibling's spouse, then that would make sense. If, in the cases, my sibling spouses aren't looking for me to do anything for them, but that's an allowed use. And so if you intend that these are people for whom the person who needs to go help them, that that's their ordinary bit that they do, that's different than just having it on the list. That's what I was getting at by definitions. And I think the more you can make the definition be what you mean and focus it in, you will find yourself with less concern from the people who have to fill in the gap from people who are otherwise legally taking this. And so on throughout the definitions. on line 12.4, it talks about inability to fully perform regular daily activities. In my whole career, I talk about people going back to temporary partial work. And so if you can't fully go back to work, you qualify. I don't think you mean that, is what I'm telling you. And the definitions on page 14, we can talk about this, but I don't know where these definitions came from. If they came from a working program someplace that they know who's actually using this, it's been refined through whatever process of time and litigation or whoever. So you really mean what you mean. Because what you mean in your head, I think, is that people who were just needing this, but as you allow it to be broader in its definition, people who are not as, people will take advantage of it who you do not intend, which will cause some of the perils that we're worried about. So I voted for this in the other committee. I intend to vote for it today just to help be in the discussion. But that's why I'm trying to help you just to, I think that we're close in our thinking.
Close. Senator Mann, let's go to the next. You want to?
Yeah, no, I would, you could share those with me. We can go over them.
Thank you. Thank you, too. Let's do this. The Summer, Spica, and then it looks like Willie Schneider. Sam, I want you to come last and bring Sean up so we can segue into the MAPT discussion. So is Willie Schneider here? Come on down, Willie. You're the next contestant, man. Summer Spica, SEIU Healthcare Minnesota and Iowa. Thank you for being here. Did you drive up from the great state of Iowa?
No. I just drove from a couple blocks down.
That was actually pretty good. That was funny. That was good. That was funnier. That was. Welcome to the committee, Summer.
Thank you, Chair Hoffman and members of the committee. My name is Summer Spica. I live in St. Paul.
I'm sorry. I can never. One of these things we're going to have to do is the pronunciation of names. You're the fourth person now in the period of a month where I've just absolutely messed that up. So I apologize.
It's all right.
Summer Spica, go ahead.
My name is Summer Spica. I live in St. Paul. I'm a union organizer who organizes home care workers. I also work as a home care worker in my community and have for almost 15 years now. I am here on behalf of SEIU Healthcare Minnesota and Iowa. Our union represents about 50,000 healthcare workers across the state. We work in hospitals, clinics, nursing homes, and self-directed home care. We support the paid family and medical leave bill because all workers, especially caregivers, need time to care for themselves and their families. One of the reasons I got involved in organizing home care workers is because I didn't get leave after having a baby when I was working as a PCA. It was 2014. I was working as a PCA for a young girl in my community. I was pregnant with my youngest daughter, Amalia. I knew it would be a challenge. Like most home care workers, before we got a union, I didn't have any paid leave at all, and I only made $10.50 an hour at the time. So I knew I couldn't save much. If I was going to feed my family and pay my bills, I needed to work. I could only afford to rest for about 2 weeks before I went back to work full-time. That included the 4 days I was in the hospital after my scheduled C-section. All moms want longer to bond with their child, but that was a luxury I didn't dare think about. I had worked hard and saved enough that I could afford those 2 weeks without work. So 2 weeks after major surgery, I was back working as a PCA. Being a PCA is hard physical work when you're in good shape. After surgery, it was brutal. All of the movement and bending you have to do to help lift, bathe, dress, or feed a person, it's not an easy thing. Not to mention all of the other changes that your body is going through and adjusting to. They say it takes a full year for a woman to recover after having a baby. I was back to work full-time 2 weeks after having my baby. No one should have to make that choice. When this country first passed laws to protect workers, home care was left out. Domestic workers were not covered by Social Security or the Wagner Act. We were left out because we were mostly women and people of color. Legislators thought we didn't do real work and didn't deserve real benefits. We know that you will not make that same mistake. We need paid family and medical leave, and I know this committee wants to do the right thing. Thank you.
Thank you, Ms. Speaker. Thank you for being here. Mr. Schneider, you know what? Good to see you from Lake Owasso Homes here, man. How long have you worked there?
Going into 44 years.
I'll have to share with you some wonderful, I knew some folks who lived there, and I miss them dearly on a daily basis. And I just want to say thank you for your work that you do at Lake Owasso, and welcome to the committee.
Thank you. Well, I am a public employee of an ICF, intermediate care facility, where I provide life assistance for individuals with intellectual disabilities and impairments to their functionality. It seems odd to be a little nervous here, given what I do for a living with the clients I work with. The client base is quite challenging at times. Be that as is, all people, be they clients or staff, are made of flesh. We all get hurt. We all fall ill. We all age. We have family members who may be injured, sick, aged, or born premature. Sometimes pregnancies don't go as planned, and sometimes interventions need to be accomplished on an emergency basis. As hardworking public employees, we look to our eventual retirement, to a time of ease from accumulated work aches and demands of deadlines. And my job has a lot of physical components. It also has a lot of paperwork involved. In planning for retirement, many public employees may count upon the conversion of accrued sick leave hours to fund health care premiums. The amount of accrued sick leave at a time of retirement varies widely based upon personal illness, injury, challenges, use of sick leave to care for a child with the flu, recuperation from knee replacement, etc. Employees may have easier circumstances as well. Less need to take sick leave, maybe different genetics, perhaps simply different luck. Circumstances, moreover, may change for any public employees, previously ill and injured, regaining their health and fitness, the once solid and vigorous falling prey to COVID, and we've all seen that. All public employees should retain the capacity to maintain a bank of sick leave, quite separate from allocated FMLA hours. Public employees are frequently unseen, as if we work below ground, up in trees, behind gates, and in wooded fields. Indeed, we are in all those places, so many more. And each work site has its hazards to our health. Public employees have families, newborns, 90-year-old parents, disabled siblings, adopted children from war-torn lands. We care for our nieces and nephews, stepping up when parents can no longer cope. We, even as grandparents, begin anew the role long last accomplished, now occupied unexpectedly by parental illness, injury, incarceration, or incapacity. We become, as grandparents, parents to our grandchildren. There is a great need for paid family medical leave under these circumstances, so many more. Public employees bleed, weep, fall, limp, laugh at the knock-knock jokes of children, build cradles of wood and sandwiches of peanut butter and bread, just like everybody else. We shatter our limbs, build cradles, get punched in the nose at work, and return the next day. There are occasions thereupon which we use our sick leave. We slip on ice, we trip, stumble, smile, we push the cars of strangers in Minnesota winter. We bury our kin and kind, we pet our cats, pick up after our dogs. We live, die, are replaced, and are sometimes irreplaceable. Public employees perform the work. Our efforts contribute mightily to the public good. We are both needed and dignified. We need both sick time and paid family medical leave. Public employees, family, community, human beings seek the security against illness, injury, and advanced age that sick leave, accruals, and paid family medical leave provide? Thank you for your time.
Thank you, Mr. Schneider. And again, I want to give you a shout out to Lake Owasso and thank you for your years of service and the folks that are residents of the Lake Owasso place. So thank you.
You're welcome.
Senator Mitchell.
Well, I just wanted to say to Ms. Spica, I know, no, you don't have to answer anything. I apologize. I just want to say how much your words resonated with me. The one time I had to take medical leave, it was because of a pregnancy loss. With my one biological child, it was an emergency C-section. And even though he was only 7.5 pounds, I had to have the bassinet raised to a special level because I was in so much pain, and I consider myself pretty tough, that it was hard to even pick him up. For about 6 weeks, I was in a lot of pain. So I can't imagine going back to work after 2 weeks. So both of the times I would have used something like this was because of pregnancy-related issues. My mom took herself out of the workplace because caring for my aging grandmother, because that wasn't accommodated. So while this impacts everyone and can help everyone, I completely agree with you that a lot of times this has to do with women and how we are able to engage as the people who are pregnant, as the people who need maternity leave, as the people who are often the caretakers, how we are able to engage and be a productive part of the workforce. You know, and even if you look at our committee here today and the number of men on the committee versus women on the committee, I think it's telling that we need more of these voices and protections so that women can be a part of the workforce. So I thank you.
Thank you.
Thank you, Senator Mitchell. Thank you, you two. Sam Smith and Sean Burke, why don't you come down, because we're gonna, as soon as Sam is done, I think I'm gonna bring up the First Amendment. There's 4 amendments that I have in front of me, Dr. Mann, I think you're aware of, actually 5. There seems to be a duplicate. You and Senator Rasmussen are on the same page, so, who gets to do that one? Is that Senator Rasmussen? So, but what I want to do is have this conversation with Sam. I'm going to segue to Sean, and then I'm going to start bringing the 4 amendments, Dr. Mann, and then we can open up our group discussion and then bring those folks back that need to be. So, Mr. Smith.
Chair Hoffman, members of the committee, and my son Harlan attending his first ever committee hearing. My name is Sam Smith, and I'm here on behalf of the Alzheimer's Association to testify in support of Senate File 2 and ensuring that every Minnesotan can access paid family and medical leave. When evaluating our support for any bill, and especially a bill that has become contentious, our first question is if this legislation will benefit our members and supporters. With Senate File 2, the answer is a resounding yes. Alzheimer's disease has a devastating impact, not just on those with the disease, but is also an extreme burden on their caregivers, a job that usually falls on family and friends. Unpaid caregivers face tremendous financial and emotional pressure and still provided $3.4 billion a year in unpaid care in 2021 in Minnesota, keeping many Minnesotans from relying on more expensive congregate care through a waivered program. Unless caregivers are fortunate enough to be employed by an organization with generous family and medical leave benefits, caregivers will often face the heartbreaking choice between their financial stability and supporting a loved one with Alzheimer's. Among Alzheimer's or dementia caregivers who are employed full or part-time, 57% reported needing to go in late or leave early. In addition, 18% had to go from working full-time to part-time, 16% had to take a leave of absence, and 8% turned down a promotion due to the burden of caregiving. More than 1 in 6 Alzheimer's caregivers had to quit work entirely to become a caregiver in the first place, or because their caregiving became too burdensome. Among female caregivers, 17% believed that they had been penalized at work because of the need to care for someone with Alzheimer's. Senate File 2 will ease these pressures and ensure that more caregivers can remain in the workforce. The Alzheimer's Association is very sympathetic to the challenges facing employers working in the long-term care field. Tight labor markets and unacceptably low reimbursement rates create real challenges that this committee is right to focus on. There is no silver bullet to the workforce crisis, although reimbursement rates play a foundational role. And we encourage this committee to think about the impact of Senate File 2 in aggregate. Researchers found the implementation of paid family leave in California reduced the number of people seeking care in a nursing home by 11%. We also know that caregiver burnout is a primary factor in people leaving their home for more intensive residential services. Moreover, reports on the elder care workforce consistently identify the lack of benefits as a key factor in people making the hard choice to leave the long-term care field. We would urge this committee to consider these impacts collectively and look to the experiences of other states that have implemented public paid family and medical leave. Thank you for your time, and the Alzheimer's Association urges you to pass Senate File 2.
Thank you, Mr. Smith. I have just a follow-up question before we start going into our segued events. You mentioned California. Do you know how they do their rate methodology in this long-term care? I mean, if they saw an 11% fix, right? That's pretty huge numbers. Do you know off the top of your head what their reimbursement rates are structured at?
Chair Hoffman, respectfully, I'm not necessarily an expert on the rate methodology here in Minnesota, so I don't think I can answer that one.
So you don't know what California pays their long-term care providers? No, that's fine. I was just teed up on that. Didn't mean to put you on the spot, Sam, but that was like, I wonder what that is. I'll take a look and see where they're at on that. So thank you. Any questions for Mr. Smith? Thank you. We might as well. We got like 45 minutes. Actually, we can go longer, but members, in front of you is the A58 amendment. And I want to premise the A58. Employed persons with disabilities, MAEPD, discussion, and that's why I'm bringing Sean Burke up. He's a lawyer by the fact. You got a doctor to the right of you, Sean. So Minnesota medical assistance on employed people with disabilities, MAEPD spotlight. Folks are treated differently than anybody else. And you got, first of all, you guys put $65 in the amendment. Let's be clear, it's 65.01, at least that was the old way. If you got to earn 1 penny more than $65 in order to benefit from MAEPD. And I think Ken Benson probably remember that conversation, 6501. But that's okay. For this discussion, that's something, if needed, we can move forward. But Sean, there's that piece of it, right? If you look at members that the unemployment insurance benefit under Chapter 268, right? There's an eligibility discussion in that subdivision. But the second part to this that I think is important, because you start getting into MAEPD in 4 months. So Sean, can you explain to us when you're looking at folks that have MAEPD, why is this important to look at A58 in a contextual, bigger conversation piece? Does that make sense?
It does, Senator Hoffman. Thank you. My name is Sean Burke, and I am at O'Connell Consulting and representing AARP today. And this is a great conversation to have. They're in line with the equity issues that Senator Mann raised at her opening. So if we do not do this amendment, then current MAEPD law will leave people with disabilities at a disadvantage.
So say that again. I just want people to hear that.
If we do not do this amendment and paid family medical leave passes, people on MAEPD will be treated differently than their peers at work.
How so?
So current MAEPD law only allows for a 4-month grace period for people on MAEPD for 2 reasons. For a medical condition, and it actually doesn't specify whose medical condition,
right,
or if they lose their job, not attributable to them. That's in current law right now, 4-month grace period. If you go past that 4-month grace period, you'll lose your MAEPD. So this is not enough to be sure that MAEPD recipients are going to be treated the same as others receiving paid family medical leave as Senate File 2 is written. So in the amendment in front of you, in paragraph B, starting on line 1.12, that will make sure that people on MAEPD, if paid family medical leave passes, will get to receive the full amount of paid family medical leave, just like their peers. Now, it will also do the same if you are receiving UI, and we can talk about that as well if you'd like.
I think there's senators that did the conversation, and people start to get, you're going to start the bucket of unemployment insurance. And I'm like, no, the bucket here is these are people with disabilities that are on a specific program of medical assistance for employed people with disabilities who are treated differently than the average Joe in the street. And so I wanted you to highlight that, which you did. So how is this, in our jurisdiction, how does this fit within whom we care about and what we care about and why we do what we do? Does that make sense to you, Sean?
Senator Hoffman, members, yes, it does. As we were doing this amendment, trying to make sure that people on MAEPD, if this bill passes, receive paid family medical leave just like everyone else, it became clear that we would be left with an injustice and a strange result if we also didn't include the UI benefit as well. Because right now, with that 4-month grace period, that's not enough time for people on MAEPD to take advantage of the full amount of UI, which people on UI can, I'm not a UI expert, but they can extend their benefits up to a whole year. So this makes those people on MAEPD whole with regards to both the paid family benefit that would pass under this statute and also existing UI law.
Makes sense to me. Members, any questions for Sean Burke? Senator Rasmussen and then Senator Mann. When we're done here, you can talk about what you just heard.
Thank you, Mr. Chair. Question, so if the leave were under 4 months under the current bill as proposed, would there be any issues, or would it only be if an individual were to take more than 4 months of leave under the bill?
Mr. Burke.
So, Senator Hoffman, Senator Rasmussen, the amendment wouldn't affect those taking leave under, that would be taking leave under 4 months, except for the fact that the current statute also isn't really clear whose medical leave is it, frankly. And so we could possibly run into some issues there, which this fixes. But leaving that aside, this amendment is specifically focused to make sure that those on MAEPD get the full amount of the PFML benefit, which is over 4 months. So it's that period between 4 months and the maximum amount of the benefit.
Senator Rasmussen, next logical question would be, and if that doesn't happen, isn't there a concern that they might lose their MA benefits? Mr. Burke?
Senator
or
Hoffman,
kicked off the program?
Senator Hoffman, yes, without this amendment, you only have a 4-month grace period if you're on MAEPD, and then you would lose your MAEPD.
Because of the fact you don't make 6501. Senator Rasmussen.
Thank you, Mr. Chair. And Senator Mann, I know you've had this conversation multiple times, and this is, I think this amendment actually highlights one of the broader concerns that I have with the bill, which is, we oftentimes talk about this bill as a 12-week leave program, and 12 weeks would be less than the 4 months, right? Mm-hmm. If it was truly a 12-week plan, we wouldn't be running up against this 4-month barrier. But some of the concerns that have been, brought up about this bill more broadly is that it could effectively be a 24-week leave plan, and then you would surpass the 4 months and have an issue with that. And so, and I know we're not going to solve that issue here today, Mr. Chair, but I do have concerns around if this is kind of being talked about as a 12-week leave plan. Let's try to work to make it a 12-week leave plan, because even in this amendment, if it were simply 12 weeks, we wouldn't have this issue, is my understanding, and unless I'm missing something.
Mr. Burke, did you hear that statement? If this was simply a 12-week plan, we wouldn't be having that issue. It is my understanding that regardless, people on MAEPD are going to be treated differently, and this just gets that equity issue that's in there on the folks that we heard about. People want to work, they want to work, they want to work and get paid. So, Mr. Burke, can you respond to that?
Yeah, Senator Hoffman, Senator Rasmussen. Yeah, I just point to real quick line 1.23 and 1.24. Under current law, you can get that 4-month grace period in MAEPD due to a medical condition as verified by a physician, but that language is still not broad enough to capture the full types of reasons why someone might qualify for paid family medical leave. So it's still necessary to make the change.
So perhaps, Senator Mann, there could be a fix going forward with this to, if it addresses that issue within the context of this discussion, that we could have protections in place for MAEPD. Does that make sense?
Yes, Mr. Chair, it does. And so in the bill, we treat the benefit as earned income, and we did that purposely. So theoretically, this language is already taken care of. However,
That's okay. This is a conversation. However, do you want to finish your sentence, or do you want to go however?
However, I have zero problems with making sure that the language is there so that our intent is indeed carried out. Second, to Senator Rasmussen's point, it's a 12-week program for a very, very small amount of people. It can be more than 12 weeks, right? But again, that is a horrific year for someone. They had a pregnancy or a new baby into their home, so they have 12 weeks of bonding, and then something happens to them. They have a stroke, they have a heart attack, or they have a horrible pregnancy that requires time to take care of themselves. Again, that is an extremely small percentage of people who will require more than 12. So I'm just throwing that out there.
No, that makes sense. So it sounds like you're willing to work with this amendment as it sits on the table, and there's people that forget more in a day than we'll ever know in this world.
One more comment, Mr.
Yeah.
Chair. So while I want the language in there, again, to provide those protections that we had intended, I don't know if having the language regarding unemployment insurance, if this bill is the right vehicle for that, as we are talking about paid family leave and not unemployment insurance, but I'm certainly open to conversation.
I think that Mr. Burke, I mean, to me, you almost have to have those going like a parallel, like you got the other body bill and they got the Senate bill going parallel. But there's one little piece in there that perhaps could use some adjusting, going forward. Mr. Burke, can you go back? Why is it important? And again, the 4-month, 12-week, 4 months, you got it. There's some ambiguity on the discussion of the disability piece. You get somebody to sign off. And my concern is, right, MAEPD, if you're not making the 6501, yes, we put that, it's covered in there, but yet there's still a caution cause for me that I'm having a conflict on. Can you help? Why is it important that we keep this language in here going to the next stop to whatever fix needs to happen in order to keep that conversation going? Because again, people on medical assistance, employed people with disabilities, are treated differently. And if you would ask me, I'm, not it's about me, but I'm personally sick of people with disabilities being treated differently than anybody else. And when you start looking at statistics, when you're talking about where's the intersectionality of equity within people with disabilities, you start adding things in and it starts going through the roof, right? I'm not going to have that off-candid discussion right now, but help us focus on that statement that Senator Mann just made.
Yes, Senator Hoffman, I think whether or not it's taken care of now or later in another bill, it would lead to a very strange result if at the end of session we'll have fixed MAEPD for people receiving this paid family benefit, making them equal, but we wouldn't have changed the UI. In the current MAEPD statute, those two go together.
They do.
They're contemplated together. And so it made sense, at least in this amendment, to move them together. Otherwise, then you've fixed the paid family medical leave benefit for people on MAEPD, but then the person on MAEPD loses his or her job.
Yep.
And his or her colleague who also lost the job, who doesn't have disabilities, gets to use the whole year of UI. and the person on MAEPD has to get kicked off of MAEPD after 4 months or stop using the UI. So it makes sense for them to.
Yeah, so help me understand the essence of what you just said. In our desire to line the cans, the beans up with the beans and the corn with the corn, you just said something that piqued me. In the MAEPD Minnesota statute, those two provisions are what? Say that term.
Senator Hoffman, they're linked currently under 256B.057, subdivision 9C treats those the same essentially.
Oh, all right. That just validates. So Senator Mann, that my whole discussion from the very beginning was the umbrella of 256B. I just answered the question that you and I were having on the floor. That fits, I'm convinced that fits specifically in subdivision 9C. And so, especially if, because again, you got the two corn cans lined up. If we remove one and put it over to the beans, then it makes no sense at the end of the day. So it is my desire that the A58 be amended onto the bill as it is now, and then, because this makes sense to me. If they are called out in 256B 507 subdivision 9C, then to me it makes sense that they travel together specifically for MAEPD. Am I clear about that understanding, Senator Mann and Mr. Burke?
Senator Hoffman, yes.
All right, thank you. Senator Mann, comments?
No comment, that makes sense.
Thank you. Members, I got to take a motion on this? Senator Mann, Senator Abler moves the A58 be amended into Senate File 2. Did I say that correctly? It's the first motion I'm given. All those members say aye. Aye. Opposed, same sign? All right. Thank you. Thank you, Senator Mann, for having this conversation regarding it. And I'm glad, Mr. Burke, thank you for your work in the Disability Law Center years ago and for clarifying the subdivision 9C for us. Senator Mann, you got there's an A53 and an A60 amendment. It's the actuarial study requirement. It looks like Senator Rasmussen moves the A60. Senator Rasmussen, A60 amendment. You want to tell us about what you and Senator Mann? It's the same language. So.
Thank you, Mr. Chair. Yes, I'd move the A60 amendment. I'm happy to describe the amendment as well.
Thank you. Yeah, good. It's all yours.
Mr. Chair, this amendment simply requires that an actuarial study be done by deed and that study be completed and presented to the legislature by October 31st of this year. The idea behind this amendment is essentially this bill sets up a public insurance product that has a bunch of different financial variables, and it'll be important to have an actuarial study done to ensure the financial soundness of this plan as designed, and to make sure that we get that information before this new paid family medical leave program is launched.
Senator Mann, to the amendment, it looks like you have the same amendment, so.
It was, Mr. Chair, it was not my intent to have the same amendment, so I'm not sure how that happened. It is definitely Senator Rasmussen's amendment, and he deserves credit for it. So we've done lots of data-driven studies. The Department of Labor did several studies, 2015, 2019, and again, to make sure our numbers are good. Having an actuarial study done on top of that is a good idea. Senator Rasmussen brought this amendment earlier, but I wanted to make sure that I did the work I needed to do to make sure that this would be carried out successfully. Okay. And so we have done that, and so I am very happy to accept this amendment today.
Awesome. Senator Utke, to that point.
Thank you, Mr. Chair, and I wanted to make sure that the author of the amendment, et cetera, was done, but the first thing that jumps out at me is we're requiring DEED to do a study, hire a third party. There's no money included in this. Does there need to be?
Senator Rasmussen.
Thank you, Mr. Chair. As a part of just this overall bill, there will be costs for deed to set it up. And so I frankly, think that, if this language weren't included, deed, would probably want to do an actuarial study anyways. This is just making sure that we formalize that request, and we'll have that information received to the legislature in a timely manner before it's introduced. So in the amendment, there's no appropriation, but the broader Senate File 2, contemplates that this system gets set up by deed, and there's money that will be made available for that purpose.
Senator Etke.
Thank you, Mr. Chair. I actually like that answer, but we rarely see something go through that's got cost associated that the agency isn't just got both hands out looking for more. So, thank you.
Why did I know you would bring that up? I love that. So as long as the chargeback doesn't go to this committee, right, Senator Etke, then I guess somebody else can pay for it, correct?
I like that.
All right, I'm glad. Did we already vote on this, say 60 amendment? All those in favor of the A60 amendment say aye. Aye. Opposed, same sign. It is adopted. Yep, sounds good. Thank you. Senator Mann, let's do your A70 amendment, and then we'll go into the discussion on the DWRS, everything we heard earlier, and that will give us some time. So do you want to do that,
Yes,
Senator Mann?
Thank you, Mr. Chair. So this is just a cleanup amendment. The intent of the bill is to take time off for bonding or a serious medical leave. The word pregnancy was in there, and it was intended, again, to be part of a complicated pregnancy, but that has been included under serious medical leave. So it's just a cleaning up the language.
Any questions for the good Senator Mann? No? All those in favor of the A70 amendment say aye. Aye. Opposed, same sign. It is adopted. So members, I want you to take a peek at the A59 amendment. Having heard what we just heard at the very beginning of this committee, I think it would be important, I was hoping we'd have a little bit more time to discuss this, but in front of you is the A59 amendment. I guess Senator Matthews moves the A59 amendment. Do you want to move the A59 amendment? You were looking at me like you wanted to move it. You don't have to move it. Senator Abler or Fate will move it. Senator Fate, you'll move the A59 amendment. Fate moves the A59 amendment. You had heard, members, just the whole conversation, and what the content of what I wanted to get to, Senator Mann, in this amendment is the fact that if you're getting, and this is where Christy and Matt and Elise Bailey will probably come in, and I'm sorry, the person to the left of you has been sitting there. I don't even know who that is. Can you, for the sake of this, can you introduce who you are and where you're from?
Sure.
Not like where you're from, but where you're from.
Thank you, Senator Hoffman.
And I don't want to know your graduate degree is or what. Just tell me who you are and where you're from.
Sure. Thank you, Senator Hoffman, Chair Hoffman, members of the committee. My name is Deborah Fitzpatrick. I'm the Director of Policy and Research at Children's Defense Fund. Before coming to the Children's Defense Fund, I was at the University of Minnesota, where I led the research team that conducted Minnesota's legislatively mandated study on this issue.
Thank you. Ms. Fitzpatrick, is that correct, or Fitzgerald?
Fitzpatrick, you had it right the first time.
Fitzpatrick, since I've been messing up with names all day today. So the intent, when you look at this, it's like, okay, there are, and you heard from long-term care, you heard from those folks in the DWRS, especially like the adult day programs, which used to be, there, Julie Johnson, and you heard the ARM providers, but you're looking at a whole series of people that we wanted to come forward to say, okay, this is how we get our rates based upon the state of Minnesota. And one testifier said, we're unique in that the legislature is the one who decides what the rates are, right? And that's always been a contention. It goes back to the 5% campaign years ago, to now we get inflation on here, or how are we going to pay for what? What's the competitive workforce factor? And the disability waivered rate system service, is a few $1 billion, right? I mean, you're talking $4 or $5 billion. It might be even more than that. If somebody from the department wants to correct me, they sure can. But I just remember 10 years ago having the discussion about changing that, right? And here we are now having the same discussion, just like we said under MAEPD, anything in that 256B bucket, right? And there's no real scientific way to get to a formula-based, which I think we need to get to somehow, because Senator Mann, you had raised point of, well, if I'm receiving medical assistance services at XYZ hospital, you know, how do I know which folks, you know, are getting their wages based upon the rate that's there? And I know that they're there. We know that they're there, right? Just like when you say in the PCA world, you know, who's receiving? Everybody's receiving those based on a weight, right? There's always a breakup, right, in Minnesota that, you know, we have, thank God for SEIU and the ability to put a spotlight on PCA workers, because now we're all talking about how do we get to people to $20 an hour, right? That conversation was never happening. And so, but that still leaves out folks then, home health aid folks, CNA folks, the PCA providers that are in, whether it be choice or tradition, those DSP providers, the folks that, you know, when people live at Lake Owasso, they're going to a day program. Those day program providers are providing whatever they're doing, but their wages are based upon the rates that are given. And so what I attempted to do in this amendment is to draw out those, and what I want to see going forward is what that looks like, right? And granted, in here, because of the breadth of this amendment, right, and is that Medicaid, right, I just did a broad stroke, we're going to need some technical assistance, and I already have assurance, and if DHS wants to come down here and talk about that, they sure can, but if they don't need to, I can say that they are absolutely ready and willing to provide technical assistance about how that could look and what it could look like, right, because that's the world they live in, right? And so, because how broadly it is here, and to be very clear, as this bill moves forward, right, some people are going to look at that and go, oh, you did a broad scope of medical assistance. Well, no, I'm not interested in paying you, Dr. Mann, you know, the fact that your rate, your wages aren't based specifically regarding how the rates are. So I really wanted to make that as clarity. And am I making sense, folks? Does that make sense? I get in Shake's head shaking there. And so that was the intent of why we did this. So with that, members, thoughts, questions regarding, you want me to go through this full amendment, or does that make sense about the breadth? Senator Utke and then Senator Mann, do you want to wait for Utke? So go ahead, Senator.
Actually, if Senator Mann would like to, I'd like to hear what she thinks about adding this to the bill. I've got comments on it.
Okay.
But if she wants to go first.
Senator Mann, well, that was the whole reason, you know, Senator Utke, was to really get this out there just so we understand. Because if we take it all this language as it is, and DHS comes with our technical assistance, says, yeah, well, there's only in the widget hospital where Dr. Mann is, there's only 5% of the folks that work there that their wages are based upon our rate methodology, and 95% of the people there aren't. Well, then there's got to be some formula that we can put in place that would be, because my whole intent here, and yours as well, and Senator Abler's and Senator Fate, our whole team here basically was saying, how do you protect the vendor and the worker from making sure that they're not, because they're already being paid these just nominal fees. So I think we're on that one. So Senator Mann, go ahead.
Thank you, Mr. Chair. So I completely agree with your intent. I think that we do need to do something from a state level to reimburse the PCAs and the DWRS workers and home care workers to cover that premium. However, the way that the amendment is structured, anyone who touches an MA patient anytime would have the state cover their premium. So physicians, nurses, respiratory therapists, nurse practitioners, I mean, this is everybody. And so while I completely agree with the intent, and I think we need to do something, I think that the amendment doesn't do quite that.
I have some responses to that. So you're looking at subdivision 3 is where you're getting that kind of, is that correct? Are we looking at the same? All right. We can sure, let's talk through that. Senator Utke.
Thank you, Mr. Chair. And, you know, I fully understand what we're trying to accomplish with this, and, you know, it's a good thing, but the first thing that comes up to me is who else? You know, it's going to be a big, long list that are all going to fall under this. And really what it highlights, I mean, whether we're talking the groups that we are right in this committee or everybody else around the state and small business, et cetera, it shows this is expensive and it's going to be a real burden to them. And so I'm kind of looking at this thinking too, how do you get it to do what you're wanting to do and not be that can of worms that creates a monster?
Yeah.
And, you know, I'll have, again, I've got some different stuff as we get further into this, but that's the thing I looked at first is, you know, some are going to be happy. It's going to help them. But then the next ones are losers. I see winners and losers pretty quick on it.
Thank you, Senator Utke. And that's, if you look at subdivision 3, the thing that pops out for me and is for any medical assistance, here's the key word, Senator Mann, rates established in Minnesota statutes that reimburse medical assistance providers, right? So we just take that, see that first statement that specifically gears toward the rates that are established by the medical assistance providers. The commissioner, now this goes back to our wonderful friends at the Department of Human Services, right? That they must draft legislation that incorporates that rate increase described, and you go back up to subdivision 2, right? So when we're looking at that, that's the piece that pulls down. Here's the rates. These are that increases the medical assistance reimbursement rates, and I bet you this is then where you started to think all medical assistance providers, right? But if we look at the word all, but we go back to my first premise argument, and if I'm misunderstanding this, the first premise argument is any medical assistance rates, so this gets back to my concern about rate methodology side of it, then I think, Senator Utke, we're focused in on the department then providing us the technical assistance that says, here it is specifically under the division or jurisdiction over those entities in the home and community-based services world. That's how I read that. I'm not a lawyer. There's a few on this bench here in front of us. So, but that's how I read it. Senator Abler, the discussion of, I keep coming back to rates, the same discussion we've been having for over 10 years. And so that's where I see that piece being aligned, Senator Mann. Senator Abler, Senator Mann, Senator Mann, your thoughts, does that make sense where you were you were starting to see, well, John, help, you were like, how does this work? And so,
Yeah, I see what you're saying, but I still think, so if we have medical assistance provider, I mean assistant enrolled in chapters 256B, and then when we go to 1.9 to 1.12, where it says 1.11, by any employee providing service or performing a task reimbursable under medical assistance. So if you go under 56B, which is just the first one that I looked at, that would include dentists.
Yeah, no, you know what I just realized is that it does do the broad scope broad stroke of that, because I went from one piece, and that if we can get the technical assistance from the Department of Human Services that verifies it down to the rate side of it, I think we'd be okay. Unless you want to add a provision in here, maybe Senator Abler or Senator Mann, if we want to do a word amendment that somehow clarifies that, just because I hear your concern about here's the whole broad scope of it, which is what I wanted to do. I wanted to do the broad because I know that there's going to be also PCA. There's, for example, in the PCA world, not the 25%, but some of them you have private pay, that are also in line with the ones that are getting their reimbursements from the state. So Senator Abler.
Well, I think that you've had a pretty compelling testimony from the long-term care side, and I think that it sounds like the author is comfortable with that. The argument for going broader than that is the medical assistance rate system, even at dentists, is prohibitively low. And this would at least not reduce it by 1% more or whatever the nominal number is. And it says you can't take that part out of your employee's check. And so then we're going to, this amendment as it's written, I think, would just compensate both halves and not put that on the dentists, hygienists, or whoever. And so it's a question of what the will of the committee is and the will of you as a chair. And that's, and I think, you know, it's, time is 10 to 5, but if you like the idea, I know that you and the author are capable of crafting an amendment for later. But at least this shows the intent of the committee that we're certainly going to talk about the testifiers who are here on the long-term care side, if that's your intention. You can then discuss amongst yourselves if you want to make it more broad. That's all I got.
No, I think you're, you know, Senator Ayler, to that point, I think you're on point on the fact of, yeah, you wouldn't use the identification of a dentist or in the case of a chiropractor, right? It's like, okay, the reason I did that, Senator Mann, was to get this discussion on the table. You know, I think I told you I like to start big, and you fine tune it. A certain senator who had the policy of this, you know, years ago, the human services policy, she used to put her hands up in the air and say, "Help me understand the essence of what you're doing as we fine tune it." And so I know that brings it. Senator Kathy Sharon used to say that, right? And this is the same construct. So I'm happy that you understand what my intent and what the intent of this committee is. And absolutely, I think it's worthy of fine-tuning as we move along the process, which is, I think, what we should do. And this is just what I'm hearing. Let's have the Department of Human Services help us identify what that universe looks like, who that universe is, right? Which I'm glad. I'm glad I openly, you know, broaden that out. And then we can either hold the bill here and have them fix it, or we can move it to the next stop. And then between now and, I think you got 9 stops with this bill, right? 9. Somewhere along the line, we can get their good technical assistance and then add it. I don't know, would you like to add it? I mean, does that seem fair, members? Huh? Senator Abler.
So it's easiest to work on something that's there and it's something that's not there. If you go to the, I don't know where you're going next. Where are you going next?
Jobs.
Jobs. The Jobs Committee wouldn't really know what to do with this amendment, but they would certainly let you repair an amendment that was stuck on here with the intent of the committee. And just to remind the committee, and well, you know this, but so we inherited elderly and disabled basic health care.
Yeah.
Dennis would be the purview of another chairman at this table.
Correct.
And so then you would take it up with her. Did you want to include them or not? And so that's my suggestion. But if you, I think it's at the heart of it. I think you're doing the right thing. And I'm really very comfortable voting to put this on, realizing we have jurisdictional limitations about that. But I know for sure you mean, and I think the author means, to cover the group homes, nursing homes, daycare, day services, et cetera, like that. So that's your intention. I'm comfortable voting yes.
No. Does that make sense, Senator Mann?
Mr. Chair, it does make sense. My concern is that, again, we are amending onto the bill that the state is going to pay high-wage workers, they're going to pay their premiums, which I think is wrong for us to do. The minute this thing passes, word gets out that we're going to pay all these people's premiums, and then 2 weeks from now when we fix it, all those people get the news that we're not going to pay their premiums. I don't think that's the right way to legislate. So, yeah, that's where I am.
No, I get that. Senator Rasmussen, then Senator Utke.
Mr. Chair, I'd then recommend, I think this is a really important issue. We heard the big impact it's going to have on stakeholders, on the disability community, long-term care. I'd maybe recommend that we lay the bill over and work to get this amendment in a proper shape.
We could
before moving
recess,
it out.
I mean, we could recess right now and go in the back room and have a discussion, I suppose, if you wanted to. I mean, that's Senator Etke.
Thank you, Mr. Chair, and I think we're kind of on the same wavelength, because I was going to say, not so much just lay it over for the next half hour or whatever, but bring it back on Wednesday. We're meeting on the floor every day, so once it's done here, it can be moved to the next committee and processed that way. So it isn't like we're holding it up another week or so. Things are moving this week, so you've got time. I mean, you could do that if you want to.
Okay.
And then we could do it first thing Wednesday, first item.
All right, I'm going to go, the committee is in recess. back in. I make a motion to withdraw the A59 amendment, and I replace that with the A55 amendment. Members, if you look in front of you, there's an A55 amendment. Senator Rasmussen?
Mr. Chair, I don't know if I see the A55 or not.
Oh, it should be being handed out. Is it? It's being distributed. I can just kind of talk about, I have the commitment from, I got the commitment from the chief author to continue the conversation. The A59 was everybody, the A55 is being handed out now, and no, I'm good. You want to just, thank you very much. The A59 was a broad stroke, and to the author's comment about, it was a broad stroke, but I specifically did that because of the fact we need the Department of Human Services to help us define the people in that 256B umbrella-ish conversation, right? Just like when we thought the amendment to MAEPD, what does uninsurance have to do with that? Well, the fact is, there it is, 256B 507 subdivision 9. There are folks that I do not want to leave out of this conversation that their wages come from the rates in the state of Minnesota. So members, the A55 narrows that down specifically to the home and community-based services pool. So as you're looking at that, with the agreement from the author of the Senate File 2, that will get technical assistance from the Department of Human Services going forward. So members, you want to take some time to look at that language. It narrows it down. Senator Fate, Senator Abler, no? You guys are looking? Senator Fate moves the A55 amendment. Senator Rasmussen.
Thank you, Mr. Chair. So just to clarify, does this include, our nursing homes, assisted living? Is it comprehensive of those care providers?
Senator Rasmussen, the answer is yes. Direct, non-professional, long-term care services and supports. So if you remember our jurisdiction, long-term care is that big bucket, and so that should be defined. The answer should be yes. The answer is yes, but clearly we're going to get some, going forward, we have the agreement to get the full technical assistance from the department. Sorry, Christy and Matt, I'm already putting you in as technical assistance providers. I'm getting the head shake over there, so the answer is yes. Senator Abler.
Well, thanks, Mr. Chair. I think it's a good start. It certainly reflects the intention of the committee. I probably have a lot of questions that are not necessary for now, but after we vote, I just have one more question. Thanks. I would be voting yes.
Thank you, Senator Abler. Members, any other? Senator Mann, do you accept this?
I do, Mr. Chair.
Thank you. All those in favor of the A55 amendment, say aye. Aye. Opposed, same sign. All right. Senator Abler.
Well, thanks. And so I think we've handled the pay issue, at least in principle. I'm interested to hear from the people who are actually going to work with this. I know Senator Mann is interested and Senator Hoffman is as well. The part we haven't handled, Mr. Chair, is the excess staff issue.
Yeah.
Which I hope can remain an open question, an open thing that we're interested in trying to solve as well.
Senator Mann.
Thank you, Mr. Chair. Are we talking about the workforce shortage? Is that?
Senator Abler.
Well, yeah, like if you have to pay 50% more to replace the person who left, you have the basic amount of money for them in your budget, but you don't have the 50%. And so, and it just, yeah, so I'll just let you answer, then I'll comment.
Yeah, so, Mr. Chair, I don't think anyone said 50%. I didn't hear that. But employers are incurring those costs now, right? When people leave the workforce, they have to train in someone new. So training in new people and increased employee turnover does lead to increased costs that this bill can potentially help with. Because again, we have seen the data that it does help with that. And so again, it does not create a need for leave. People are already leaving. Employers are incurring the cost now, so this is not a new issue that this bill brings about.
Senator Abler.
And Senator Mann, I appreciate your optimism. And so, so we'll discuss this much more. I think this has been a really good discussion. I think the points of some of the members that we've been able to look after our niche at least pretty well. Probably the best treated niche so far of any of the niches. And particularly since these places rely 100% on state and federal money and there's no private source except for occasional bake sales that they may have or a foundation that may do some fundraiser or something which just fills in their gaps. So, but I just would like to have the discussion remain open a little bit about what that effect may be. And so if you're right, then it's a non-issue. And if you're not, then, and if more people that have just been, gritting it through, have been going through there, and I think there's maybe more of that than you might think, and they find themselves short, they're still going to be unable to serve. So I'll leave it at that. Thank you.
Senator Rasmussen.
Well, Senator Mann wanted to say something.
I don't know. I wanted to go to Senator Rasmussen first.
That's
I want to hear what she has to say.
You want to hear what she has to say? Senator Mann, do you want to, since our senator from Anoka, wanted to, that's okay, Senator Mann.
Finish your thought anyway.
Finish your thought.
What is the alternative, right? Do we continue to tell moms to get back to work at 2 weeks with a 2-week at home? Do we continue to help people that can't work in a healthy way because they have some kind of medical illness to get back to work? Do we tell people that have cancer that they need to come back to work the day after their chemo while they're vomiting? Like, what is the alternative? We talk about people are all going to leave the workforce, which they're not, because we've seen it in other states, they don't. But if our main goal is to keep people at work, are we saying that people's personal lives do not matter? That people's health does not matter? That people's babies do not matter? I have a hard time with this argument of what's going to happen to the workforce when, again, we have data that says that the workforce is largely unimpacted, and with long term, it gets better because of increased employee retention. So it's just something to think about. This argument just doesn't sit well with me.
No.
Mr. Chair.
Senator Abler.
All I was saying, and I wasn't saying any of that, just like if indeed they wind up being, for some reason, unforeseen to whoever, they wind up having a harder time finding people and they have to pay an upcharge, we should just pay for it. That's all I said, because that's our charge. That was my only
Totally.
thought.
No, I get that totally.
I think I'm done now, Mr. Chair.
No, you're good. I think the total conversation has been what's our charge, where our jurisdiction is, and the people we care about. And is before we go to Senator Rasmussen, I got a note from a provider who used to work at one of the departments in the state of Minnesota as like an assistant commissioner type, and that person said, very much appreciate the ongoing and courageous advocacy for individuals with disabilities and those providers supporting them, and especially throughout much of this conversation you had on Senate File 2 and the amendment. So this is somebody just saying thank you for the conversation, and this is where we're at. Senator Rasmussen.
Thank you, Mr. Chair. Process question for the bill author. I believe this is the 7th committee stop for this bill. Could you talk about what the path for the bill is? And it's also my understanding that we don't have a fiscal note yet for Senate File 2, and was wondering, Mr. Chair, if the bill author had any information on when we could be receiving a fiscal note.
Senator Mann.
Thank you, Mr. Chair. So I don't know when that fiscal note is coming, but we need to go back to jobs, taxes, and finance, and we won't do any of that, it is my understanding, until that fiscal note is ready.
Senator Utke. Yeah.
And I hope I didn't just miss something as I was looking at some things, but with the amendment we just passed, it's got a large fiscal impact. Where are we at on a fiscal note for the whole bill? And can this be added to it, or at least will we know by the time it gets to jobs what we just added?
So Senator Mann just doesn't know what it is, but you're correct, Senator Utke. The amendment we just did, we put in place that we are going to I'm sure that's changed, and that's why I think the technical assistance from our wonderful friends at the department is going to be helpful in this piece on it. But to your point, Senator Rasmussen, we were just raising, so you didn't, you're good. I think we got that. And I think Senator Mann, yeah, that was funny. Senator Mann, I guess we'll answer that question when it comes soon, right? But as far as the disposition of this, it goes to, I think we're going to refer this to jobs, correct?
Correct.
So, any other comments, questions? Thank you, everybody, for this. Thank you for bringing up, this really gets to why we do what we do here. And Senator Mann, thank you for bringing your bill to the committee you're part of, which really specifically there. So all those Senate files, Senator Mann renews her Senate File 2 as amended, be re-referred to jobs. Did I get that right?
Yes, Mr. Chair.
All those in favor say aye. Aye. Opposed, same sign? No. It passes. Thank you. We are adjourned.